If you need to do a grade 1 mode because you're trying to calm down pain, you can do it in sitting or you can do it in supine. Some people, when they're acute, they can't lie supine. You do grade 1 techniques, grade 2 mobilizations in sitting. It helps to dampen their pain. It works out great. Right? You get them down here, you can apply more force, or if they're comfortable, they can relax here. You might do grade 1s and 2s to calm down pain and start to open up their ability to move and do motor control stuff. All right? So it's totally dependent on your patient. The reason we check the PAVMs in sitting and supine is because in sitting, maybe you don't feel hypermobility. Maybe you're in sitting, it feels stiff. You're like, oh yeah, that accessory glide, that feels stiff. And then you lie them down, and all of a sudden you do the exact same accessory glide, and it goes on for miles. Okay? What happens if you come across that?
Guarding for instability.
It's what? Hypermobility, exactly. And in sitting, they were guarding. So in sitting, they were hiding a hypermobility because they were compressing the area. And you checked it, you're like, oh yeah, that's stiff. So you mobilize it like crazy, and then they get worse. So if you check their PAVM in sitting, and then you check their PAVM in supine, and it's like, whoa, that's not restricted, they were fooling me. Now you know that you have to focus on stabilization or look for a hypomobility elsewhere because that level is already too hyper. Don't give them more motion at that segment. Thank you. Yes. Thank you very much. Yes. You're definitely the most excited student in here. As it was in Michigan. Yes. All right. As we can. Inside joke. All right. So here you can use a CV lock, or you don't have to. All right. It's a more advanced technique. If I'm going to do a CV lock for her, it looks like that, and now I can use her head as a long lever to do a treatment technique. But you could do what we did in the PAVM assessment, where I'm coming in, I'm hugging the head, and I'm keeping it in neutral from the C4 and above. All right? And now, everything that I do, I'm moving her head and upper neck along with me. So how am I going to lock her?
With handcuffs.
Oh, you're on a roll. Side bending, how am I going to do the side bending?
That should go on the quote wall.
You can definitely translate. That's exactly what I'm going to do. I'm going to lock her from below. Okay? So if I translate her this way, alright, if I translate this way, what kind of side bending is, I translate to the right, what side bending is associated with this? Left side bending. What downslide is, which side is downsliding? Which slide is upsliding? Right. So from right here, I can translate her. That can help me localize the segment, and from right here, I can start to do a downslide. Okay? And then, or I could hook and I can do an upslide, so I can do the treatment just like that.
This seems way easier
than
yeah. Why would you do it the other way?
Because there's some patients you can't do it this way.
Like for what kind of reason?
They can't lie down. If they have spasm, they can't get comfortable lying down.
This is so much easier.
Also, when you do movement re-education, you do it in sitting. All right? In the acute phase, you can be very delicate in sitting. They can't lie down. They're very acute, and you can do plenty of techniques that way. So you have to do both. All right. So as you're here, I'm going to translate her. I can do a downslide mobilization. So I'm just starting to kiss the barrier. All right. I'm not any further, and I can do grade 1 mobs right here. Okay. You can do the grade mob with the inside of the MCP, or you can pick more of the meaty part of the first phalanx, depending on the person and depending on you. Okay. If I want to really get an end range glide of her left facet into downslide, what do I need to do? Extend. How am I going to extend her? Exactly. I'm just going to create a little pitch up, right, that allows her to extend right at that level without extending CV. I translate. That's a good one. That's a good one. A little stiff right there. Translate her over. Okay. Get around the muscle a little bit. So what I just did was an unwinding. When I went to go over, she has a stiffness at this segment. And her body said, nope. So then I said, okay, dance with it a little bit. Just let it shorten, unwind, and then just let me in. I danced with it. Now I've extended or translated, and now I can do a downslide. Okay? What if I want to do a right upslide? Flex. Okay? Bring her into flexion. Rear belly contact. Okay? Translate her over, and now same thing as the PAVM, but now I can grade it. Treatment's here. Okay? How am I going to do a muscle assist if I'm trying to do the up slide on the right?
As on the side bend, right?
Side bend left.
Okay. Muscle assist.
Side bend left.
Side bend left. Why left?
Because that forces them to use that.
They're helping me to go into the direction that I'm working for.
Oh, okay.
Now, don't let me side bend you to the right. You ready? Don't let me side bend you right. Hold. And now relax. And I take up the slack. Get the glide going. Okay, don't let me side bend you right. Hold. Relax. Okay? And then you do the treatment there. And you come in and out of it. Usually now that you just did end range mode. So now what am I doing right now?
Dancing.
Dancing with her.
I'm dancing with her. I'm right on that segment. And I'm doing... you go park the car down here. So I'm helping the up slide, and then I'm helping the down slide. Right? So now I'm moving the joint around. Stanley Paris will call it a boggy joint. A joint that just doesn't have a happy glide throughout its whole range. You mobilize the end, and then you do a little bit of mobilization. This is kind of a mobilization with movement. I'm side bending there as I'm doing an up slide and a down slide. Up slide and down slide. This right here is a great finishing technique. This technique, bias to the flexion or extension with translation, mobilization, muscle energy, either assist or resistance, followed by mobilization with movement. That's going to be probably your most used cervical combination of techniques that there is right there. Okay? So you have 30 seconds to practice it. Good.